Good afternoon to all of you. It is good to see you in this way. We continue to be grateful for the ability to convene virtually like this. And we have a special guest today that it seems so appropriate to be featuring another public health professional, distinguished doctor you'll hear more about in just a few moments, given where we are as a court family. We've reopened our doors to the public. We have a phased reopening with court operations. And sooner rather than later, we expect to see jury pools from all across the Central Valley coming into our courthouses. And so in comparing notes with Keith, it just seemed essential to make certain that we continue to facilitate getting you the best information possible on what's happening at the current point in time, so you are fully informed, can make good decisions for yourself, and be fully present in your essential jobs for the court. So welcome to all of you within the district court family, the bankruptcy court family, the probation office, the pretrial services office, and the marshal's service, and perhaps other fellow travelers. Thank you, thank you. It's now my pleasure to introduce our clerk of court, who will introduce our guest speaker this afternoon. Keith.
Thank you, Judge. It's my pleasure as a UC Davis graduate to introduce Dr. Stuart Cohen. He is the Chief of Division of Infectious Diseases, the Director of Hospital Epidemiology and Infection Control, and a professor at UC Davis Health. Dr. Cohen graduated from Chicago Medical School after a Bachelor of Science at the University of Illinois, Urbana-Champaign, hard for me to say. He did his residency at the University of New Mexico in internal medicine and had a fellowship in infectious diseases at UC Davis Medical Center, where apparently he stayed. In reading about Dr. Cohen, I was happy to see that he uses humor and compassion when treating his patients, personalizes care to their needs, and feels appropriate immunizations and the patient's educational knowledge about his or her condition are most important for good health. Dr. Cohen, thank you so very much for joining us today. We look forward to an update on COVID, variants, vaccines, and returning to the workplace, and hopefully you'll answer some of the questions that we have. Thank you. Dr. Cohen.
Yeah, well, thank you all for inviting me. And I didn't prepare any slides for this. I thought that this could be done with just discussion. I hope there are a lot of questions because I think that's important. But let me start off with just one quick statement, or maybe it's a series of two or three that package into one concept, which is what we know today on June 28th, 2021 is more than we knew on February 25th, 2020, which is when we identified our first patient at UC Davis. And we will continue to learn more things and things will evolve. And so I think it's important for people to understand that that's the process of science, and that if we knew everything about this at the beginning, we probably could have done a better job of stopping it, and we could have figured things out much more rapidly than we did. And so I think when people question some of the information that's being provided, you have to look at it in the context of when it's being provided and what information is available. And that what I say today could change next week. I just want you to realize that before we even start. And then the second thing I want to point out is relating to the preparation and testing of the vaccines. And then I'll get into the current California circumstances, particularly those locally, and then talk a little bit about the vaccine effectiveness and then how the variants are going to potentially play into all this. So first, the vaccines were not rushed through. So everyone wanted them quickly, and as quickly as they could develop them, they have been developed. There was an illness called SARS, which many of you may be familiar with, that occurred in approximately 2003. It didn't really affect the United States very much. It was seen primarily in China, in Singapore, and then there was a big outbreak in Toronto, in Canada. And that was caused by SARS-CoV-1, the progenitor of this current virus. And at the time, it was thought that this could become a global pandemic as well, and that a vaccine would be a good idea, so that the technology and everything that has been used to develop these mRNA vaccines was developed back in 2003, with the idea that we were going to be vaccinating against SARS. And so what happened is science is fast now at getting the genetic sequence of the virus. And so shortly after the virus was identified in December, the sequence was already known and people were already developing a vaccine. So even though it seemed like a rushed timeline, the development had already been in plans for 15 or so years before we even got to the point of making this current vaccine. And the testing process included over 30,000 people in the Moderna trial, almost 45,000 people in the Pfizer trial, 40,000 people in the J&J trial, and 30,000 people in the trial that was just reported from Novavax. So these are all big studies. What is missing is long-term follow-up. So the longest term follow-up for the Pfizer and Moderna vaccine is probably somewhere around 15 months. So we can't tell what's going to happen 5 years from now, except that there are no vaccines that I'm aware of where things happen way, way downstream that didn't already happen at the beginning. So some people may have complications of the vaccine, but those are identified relatively early and then they persist. So it doesn't come up out of the blue late after the onset of the vaccine. So a year after you get vaccinated, the chances that something is going to happen is remote. The other comments about the mRNA vaccines, once they make the protein called the spike protein, which is the target of the vaccine, the mRNA is destroyed. And so it does not integrate into your genetic material. It's gone shortly after it has been given. There's no issues with cross-reactivity with placentas. It's been safe in pregnancy. It doesn't decrease sperm count in men, and it doesn't change fertility in women. So I just want to start with that as a basis and a background. So I think we've been through 2 big spikes of cases in California that have not been equally distributed throughout the state, right? So the Bay Area has always done pretty well. LA had a pretty rough winter. Here in Sacramento, we had also a bit of a rough winter, but not to the degree that they were at. We're still seeing cases here in Sacramento, and I think that part of the issue is that people who get infected are immune, and then people who get vaccinated are immune. And once we get a particular number of people protected, we start controlling the disease. So the tier systems were removed. The mask mandate was removed, but people who are not vaccinated still are supposed to be wearing masks. It's all the honor system. So we're trusting that that is what's actually going on. The distribution of the vaccine, though, which seems to be in large part what's getting things under control, is also not equally distributed. So for example, in Yolo County, almost 80% of people over age 65 and most adults have been vaccinated at least one dose. Sacramento County, we're closer to 60% of adults that have been vaccinated with at least one dose. So there's still a lot of work to be done. And I think that's part of the discussion about getting people back into the courtroom or into any other workplace. Is transmission is higher indoors than outdoors. I think everyone's well aware of that. Ultraviolet light and air disbursement in the outdoors decreases the amount of virus that anybody is exposed to, even if they're standing next to somebody who's actively infected. Whereas air exchanges in businesses, I'm sure in the courtroom, are not modulated in the same way that they would be in an isolation room in a hospital. And so I think that it's important to try to get the most people possible vaccinated, but to make certain that there is some way that people take responsibility if they're not, to be masking and trying to keep things under control. Since it is also clear that with the emergence of some of these new variants, there is a chance that things that have been in control get out of control. And I think that's being seen now in Australia and in Israel. Both countries have done extremely well in keeping the disease down, and there are certain areas within those countries or that continent for Australia where they are mandating masks again. And so things may be fluid. We're all pretty pumped right now to be finally walking around. I'm not even sure how much you really want to see everyone's face all the way through, right? You're so used to just seeing their eyes now. It's a shock sometimes. There are some people that work with me that I've never seen their face until like last week. And so it's an interesting scenario. And I think that that's the problem. And I think that the areas that are most vulnerable are the areas where immunity is not as well ingrained, meaning that the percentage of people who have been infected plus the percentage of people who have been vaccinated is not high enough to keep things under control. And the thing about this so-called Delta variant right now is that it is just much more transmissible than the prior variant, which we were already dealing with, which was the so-called Alpha variant, which is the one that started in Great Britain. So, and when that came in here, that also kicked up the pace a little bit. So vaccinated people are equally protected from that strain, but the people who are not vaccinated are much more likely to transmit it to somebody else. And what we don't know about vaccine protection totally at this point, and I'll get to the numbers in a minute, but what we don't know is how many people actually get infected that don't have symptoms. Most of the clinical trials, in fact, all the clinical trials, monitored people getting sick and people being hospitalized. What we know is these vaccines will keep you from getting severely ill, will keep you from being hospitalized. But we don't know that it doesn't potentially transmit and you don't end up getting infected, and then you may be capable of transmitting to somebody else. So that's where the variants become concerning, because if you need less virus to pass it around, then even somebody who's controlling the infection because they're immune, but still infected, can potentially transmit. So finally, let me just talk about vaccine efficacy, and then I will try to summarize this in a way that makes sense, because I've sort of been bouncing around a little bit. The 2 mRNA vaccines were shown to be approximately 95% effective. So what that meant was, when they did the clinical trials, let's just say there are 20,000 people that get vaccine and 20,000 people that get placebo. And then they determine how many people get infected in the vaccine group versus the placebo group. When they look at the total number of infections, 95% of the infections occur in the placebo group, and only 5% of the infections occur in the vaccine group. That's what they mean when they say that it's 95% efficacious. And so that still means that there are 5% that do get infected and do have symptoms enough that they got tested. We also know that the immunity lasts. So at least 6 months out, the antibody levels are pretty much the same with the Pfizer and Moderna vaccine as they were 2 weeks after they were vaccinated. And we also know that the percentage of people that get infected in that 6-month time period is another couple of percent. So it knocks the numbers down to about 91% from 94, 95%. So they're still highly effective at very least 6 months out. There have been some recent studies that also point out that there are immune cells within the body that make antibodies that are very long-lived. So the debate as to whether we're going to need booster vaccines or not, I think is still open. I know there are people who are doing it already because vaccine is easily available and it's free, and people who want to be optimally protected have been already getting booster doses. But to my knowledge, there's no real clear evidence that that's absolutely going to be necessary, at least in the short term. Ultimately, I suspect we will be getting vaccinated against this virus every couple of years, sort of like a variation on the flu vaccine, but that's just trying to be a prognosticator, which is not really my forte. But I think that that is an important concept, is that the immunity does last. It probably wanes a little bit. We also don't know the effect of what we call T-cell immunity or cell-mediated immunity. So there are 2 arms to the immune system. One are the antibodies, and then the other is the T-cell stuff. The T-cell stuff is what we learned with the HIV pandemic, right? That when those T-cells go away, people are at risk for certain infections. And the T cells are also very long-lived and may also team up with the antibodies to help control viral infections. There have been very few studies looking at T cell function after vaccination or after clinical disease. The last thing I'll mention about vaccine is that there's been a debate as to whether people who have been vaccinated or who have been infected already need to get vaccine. We have been suggesting that people get vaccinated because we think that it'll make the immunity more durable. We also know that probably one dose is enough, but since there are no formal recommendations, we're still recommending 2 doses. There was a recent paper that has not yet been approved for publication, but has been posted on one of these, what we call preprint servers, so it's not been peer reviewed yet, from Cleveland Clinic, that suggests that maybe people who have had infection don't need to be vaccinated at all. That may move forward. Since I'm going to be promoting vaccine, I don't really want to blow my my whole story, but I do think that this is something that I think people need to be aware of, and that this may evolve as well. So, in summary, I think that we've all been through a lot. We're all tired. We're all sick of masking. We're all sick of Zoom. Gee whiz. Who would have thought, right? Although it's convenient, you can get signed up for 15 meetings in one day because you never have to leave your chair other than to go to the bathroom. And so, I think we're all tired. We want to get back to real life. We want to start interacting with people face to face instead of on cameras. And I think the vaccine is the way to do that, because the more people we get immune, the better we are. And the variants can be problems, but they're not problems if everyone gets vaccinated, because that's going to stop transmission, and the variants can't avoid the antibodies, at least not yet. But what we've learned also, I guess I should recapitulate this, that viruses just mutate. That's how they survive, right? This is all survival of the fittest. So the virus becomes more fit as it mutates. So it's going to find ways around everything, the more people who get infected. And so we got to shut the door. That's the ultimate answer. As far as what you can do in your workplace, I think it seems to me that you can, I'm not sure that you can actually ask people whether they've been vaccinated or not, although I don't see why not, but I think that there are challenges to that ongoing, and you guys know better about that kind of stuff than I do. And so I think if people are vaccinated, they shouldn't have to wear masks, even indoors. I think they don't necessarily need distancing any longer. But people who are not vaccinated need to be masked. Personally, I wouldn't have people eating or drinking other than in defined areas. You may already have that in the courtroom. I can't really, but I seem to think that when people are in the waiting room for being picked for pools, that they can drink and eat, and that probably shouldn't be allowed. I think other than that, I think you can start moving sort of towards normal, with the idea that it may end up having to be modified as time goes on. So as an example, we are starting to have face-to-face meetings here at the hospital. When there's no patients involved, when there's no one in the general public involved, and we have these little dots on our badge that tell us whether we're vaccinated or not. We are sitting in rooms together without masks on. I think that when we're seeing patients, when we're in the public area of the hospital, we're still masked because the CDC and Cal OSHA rules are separate for healthcare facilities than they are for other workplaces. I've gone on for about 20 minutes. I hope that this has covered most of what you want. So get vaccinated, get the majority of you guys controlled, and you're not going to have any outbreaks within your courthouse, variant or not. And just keep in mind that things can change, and we may be modifying this sometime in the near or far distant future. I can take any questions that anybody has.
All right, I think between Jenna and Daniel, are you facilitating questions?
Yes, excuse me. Yes, I just posted for folks to, if you would like to ask a question, to put it in the chat, or you can unmute yourself and ask your question to Dr. Cohen.
Well, there are already a couple in the chat, so let me just start with those. So the first one says, because vaccinated people may still be able to transmit the infection, what advice do you have for parents with children who are too young for vaccine in terms of masking, social distancing, returning and resuming school and preschool? So, first, again, the chances of getting infected and transmitting is very small, but it isn't zero. And so that is something to keep in mind. The kids who are too young, at least when they're in public, they should be still masking and keeping distancing. And presumably the schools will try to up their ventilation systems a little bit, and that the teachers will be vaccinated, or if not, they'll be masked as well. So, you know, I keep telling myself, as well as others, eventually we have to move forward, right? We have to start getting out of our caves. And I think that the kids in school and preschool have probably not been educated to the degree they would if they were back in school. And I think we have to do everything to get them back and get things moving. And I think vaccinating everybody is gonna help greatly. Have you had many patients get COVID when they've been fully vaccinated? I have two aunts that just got out of the hospital for 19 to 20 days with COVID. They were vaccinated in February. I'm not sure what the variant. So, so we have had some. We have had several people hospitalized, but most of our healthcare workers that have gotten infected are minimally symptomatic enough that they would get tested. So there are breakthroughs. As I mentioned, even at its best, there were still infections in the vaccine arm. And so even though it accounted for only 5%, there are people who get infected. I don't know how old your aunts are and how things have worked. And but that is something that I expect is going to happen. Regarding the variants, we are relatively limited in the state of California as to, and for that matter, in the United States as a whole, for the variants and the genetic sequencing of variants. So we know that there are the Delta variant here in California. We also know still that the Alpha variant is the predominant strain within the state of California. And also the so-called California variants, which I don't know what Greek letter they were given, are the primary viruses here. But as you've heard already, in the United States, the Delta variant is accounting for almost a quarter of the new cases at this point. And so, so probably your aunts who may have been infected several weeks ago, it probably was the Alpha variant if I had to take a guess, but I really don't know. Any suggestions for keeping jurors safe? Yeah, so, right, so that's part of, if I ran the world, everyone would have to show me their vaccine when they walked in the courthouse, or else they'd have to be masked and distanced. That's the best way to keep people protected, and I think that would be the my suggestion. Again, we can't even do that here at UC. At least to my knowledge, we cannot. If people can voluntarily tell us whether they've been vaccinated or not, but we can't really ask, is what I've been told. So I have no idea how this all works. How does the new variant affect children who are under 12 who are not eligible to get vaccinated? So that's a really good question. I think it does suggest that it may get transmitted a little bit more rapidly. You know, reflect back. So at the beginning of the pandemic in February and March of last year, we had a little blip of cases in the state of California, and we locked down early, and we had everything totally under control. Right, everyone thought that it was good. Everyone thought that was going to be the end of it. That was unfortunate that wasn't. But then all of a sudden, come winter time, there was an explosion of cases, particularly in LA. And that's when those California variants first showed up, and they were a little bit more transmissible, and it associated with a lot more cases occurring in a very short time period. And I think what we saw with the Delta variant in India was the same thing, that all of a sudden it just went right from 0 to 60 in 2 seconds. And it just went flying up. So I think it does make it more likely that if kids get infected, they're going to transmit to somebody else. And, you know, the good thing is that most kids don't even get sick. There are some that do, and there are some that end up with the what's called MIS-C, which is an immune disease that occurs after the initial COVID infection. which can affect the heart and can affect some other organs. It's a concern, but it's a very small number. And so I think that, again, that's why the adults have to act like adults and do what they can do to protect their kids, which is to get vaccinated. When can we expect final approval of the vaccines? So I think the RNA vaccines, Pfizer has already put in their application. I'm not sure whether Moderna has or not. I think this is going through the more standard FDA review of vaccines at this point. So I'm thinking maybe August would be a reasonable timeline to actually see final approval. That's what I'm thinking. As I say, there's still one more vaccine, the vaccine from Novavax, that will probably end up going to the FDA for EUA. I think maybe in sometime middle of July. But that'll be a bit behind too. That vaccine, for people who've been a little bit uncomfortable with the idea that mRNA vaccines are new technology, the Novavax is a more traditional vaccine built along the same lines as the hepatitis B vaccine and as the new shingles vaccine, Shingrix. Those are very similar in the way that they have been put together. So for people who just don't like the new technology, hopefully that will help pick up another group of people who are a little bit leery about the mRNA vaccines. Have studies been done to show that second time contracting COVID symptoms are worse or less severe? Yeah, so they are less severe actually if people get infected a second time. That is clear. One other thing I guess I'll point out before I get to the next couple questions about kids is there are a group of patients who are getting vaccinated who are not getting protected. And those are transplant patients and patients with hematologic malignancies like leukemias and lymphomas. So there is evidence that in that group of people, up to half of the patients won't have antibodies and won't be protected. And so therein lies part of the deal. That's why we're still masking in patient care areas, right? Because this is we're all about trying to protect the most vulnerable in the population, which at this point is that group of adults and then kids under 12 who can't get vaccinated, right? I think those are our vulnerable populations now, as opposed to us older people at the beginning and people who lived in skilled nursing facilities. By the way, no one's heard about a single outbreak in a skilled nursing facility since vaccines rolled out. I just want to point that out. When we were hearing about outbreaks weekly, it seemed, if not more frequently. So for those concerned about whether the vaccine's really doing anything, those are that's clear evidence that it does. How would I balance social needs of our kids with COVID risk? For example, my toddler is participating in a youth sport where masking isn't being enforced, but she loves it. would you keep her in? Yeah, that's really a tough question. I hesitate to say. My son is 29, and so I'm trying to keep him out of other stuff. And so I think I am, I guess it depends on the sport, and it depends on the kids, and it depends on the other people there. My general sense would be that I would keep her in, but I'd have to evaluate the entire situation. Do I have an opinion regarding kids being masked at school? Yeah, so I think the kids under 12 that are not vaccinated should be masked, and I think the middle school and high school kids that don't have vaccines should be masked. That's indoors, right? I guess that's the other thing I should have said about the sports. If this is soccer or an outdoor sport, you get the benefit of being outside. And if it's in a small indoor area, that may make the risk a little bit higher. I mentioned booster shots for Pfizer and Moderna. Is that a special booster formulation or the original formulation? Is there any downside of getting a third shot of Pfizer and Moderna if you've had 2 doses? So the people who are currently taking third shots are getting the same thing as we got back in December through February or March, when most of us had been vaccinated. So so there are new formulations that are being developed that will target more of the variants, that will potentially be put together sometimes as a pool, right? When we take flu shots, there are either 3 or 4 strains of influenza, depending on the vaccine type that you get. It may ultimately be that that's what's going to happen with COVID too, is that it's going to be several strains of SARS-CoV-2 that you're going to be, that we're going to be targeting. At this point, I don't think there's a downside to getting a third dose. I don't think there's an upside to it either, at least not that I've seen yet. So, so I wouldn't encourage it unless somebody knows that they didn't develop antibodies. And so that we have seen, for example, with organ transplant patients, that if they get a third dose, there's another percentage of people that end up getting antibodies. So I think that should be done with your physician and under using some type of criteria to decide whether there's a point in giving another dose, rather than just walking into Walgreens or CVS and saying, I'd like another vaccine, which I'm sure they will be able to provide. In the news today, a report that the Delta variant had appeared in Fresno County, and there is concern among medical professionals due to the relatively low percentage of vaccinated eligible folks in that county, because courtroom proceedings are obviously indoors and can be lengthy. Do you still believe those vaccinated but working in those conditions need not mask? So that's a terrific question, because that is the whole concern here. You have really crystallized exactly that. I didn't know exactly where your district all went. I should have looked that up ahead of time. I apologize for that. And so I do think that that's potentially problematic. And, you know, I would still say that because you're vaccinated, you're likely protected. and that you really don't need to mask. But to be honest, I think if people feel more comfortable masked, I don't think there should be any reason that they can't be. I think that, you know, I don't want to sound wishy-washy on this, but I don't wear a mask when I'm going to the farmer's market. I don't wear a mask when I am walking into the grocery store for a few minutes. But if I'm there for a long time, I may opt to wear a mask. It depends. It depends what I see. If everybody else around me is wearing masks, I put one on too, just for everyone's comfort, because you can sense whether other people are anxious about it. And so it's sort of a personal preference. We've always said that here, we've mandated masks for a long time, but we don't mandate N95s or anything like that. We do allow people to use them if they need to use them, to feel comfortable doing a procedure or doing something that they need to do. Although there was a recent paper that suggested that in regular life, there's no real advantage to an N95. So that's another thing that you don't really need. A regular little surgical mask is good enough. So that's not really totally answering your question, but I would say vaccinated people should be protected, even with unvaccinated floating around. The unvaccinated should be masked. But if somebody said, I want to wear a mask because I don't feel comfortable, I would say, fine. That would be my take. Follow up on youth sports. Basketball, indoor, big gym, 4 and 5 year olds. Yeah, I think that's probably fine, right? I think that should be okay. Any estimate on when vaccines for kids under 12? So those clinical trials are being run now. They're much smaller. The kid trials are smaller because they're basically looking at safety and efficacy in a smaller and just a subset of what they've already seen before. So the FDA has allowed these pediatric trials to be about 1/10 of the size of the others. So so at very least, I think the Novavax trial, which is the one that we've been involved with, was 3,000 kids instead of 30,000 adults. So I know Pfizer has been going full bore on it. So I suspect give them another couple of months. Is COVID here to stay for our lifetimes? You know what? I told you earlier that I'm not really a great prognosticator, but I think yes. And I think it's going to be like influenza, that we're going to just deal with it each year. And once we have things stabilized, so that it's not circulating so readily, I think it'll be much more manageable with vaccine. You know, when you think about it, first of all, I don't think people realized at the beginning how transmissible this virus was. Everyone was talking about this being a droplet virus, which it is predominantly, but it does appear more capable of being aerosolized. And the fact is that when we've been all running around wearing masks, we've seen almost zero influenza here in the hospital. I think the numbers of people that we've hospitalized with influenza can be counted on my one hand. And so these masks are super effective. I haven't had a cold all year, right? It's fantastic. right? There are a lot of things, right? It's protected against a lot of stuff. And what it has protected least well against is COVID-19. And so I don't see how this is going to disappear into the atmosphere. But I do think we're going to be living with it. But I think also once the density of the population that's infected goes way down, you can see it's harder to transmit. Even, right, that's why those curves go up and go down. And when you're at the peak and you've got a high density of infection, it's really easy to run into somebody else who's infected and end up getting infected yourself, as opposed to when it's really low, maybe it's only every 10th person or every 20th person that you run into that's infected. And so the chances of transmission are much less likely. Let's see. If your child's teacher was not vaccinated and the child was under 12, would you send them back to the classroom? FYI, my 12-year-old's teacher chose not to get vaccinated and got COVID after Easter and ended up spreading it to 18 students in the classroom, even with masking and 6 feet. Yeah, so this is a couple of things. So first off, assuming it's that same teacher, he or she may already be immune now because he got COVID. So that may protect people from getting another round of infection. As I mentioned, ventilation is really important. And I think that's when the whole aerosol thing comes into a much bigger focus, right? Because what you see is in these contained small spaces, the virus can sit around in the air for a while, and none of these masks are totally sealed. And so there are chances that people are going to get infected. And that's why part of the whole process of getting schools ready to open back up again should be to set up some of the ventilation, right? I know that my son's school was remodeled where he went to grade school. And they took out all these big giant windows they had in the school that could be opened and put in these little small windows that can't be. And those big windows would have been really nice for this. And so I think that there are a lot of issues, but ventilation is really critical to keeping transmission down here. That's why hopefully they've also cranked it up in the courtrooms if there's a way to do it. I know that even in places of worship, people have been trying to do the same thing, where they because once they start getting or have already gotten congregations back, they want to make sure that they don't end up being a super spreading event. And so they've tried to crank up the ventilation system. So I did say that mRNA is shortly destroyed after it's administered. So I will explain it. So just to go through some basic biology that most of you, if not all of you, are well aware of. DNA gets made into RNA. RNA gets made into protein. And then protein gets put together to put us together or to put another organism together. SARS-CoV-2 is an RNA virus, so it doesn't have any DNA. The RNA is the genetic material for the virus. That is the code for all the proteins that are necessary to make the entire virus that you've seen 8 million pictures of on TV. And one of the proteins, the one that makes it look like a corona, that makes it look like a crown, is the spike protein. And that spike protein is the target of most of the antibodies that prevent transmission and control the infection with that virus. So what's done with these mRNA vaccines is that there's a small amount of RNA that just carries the genetic material that allows the virus or allows the body to make spike proteins. And it's put in a little lipid capsule. And then that's what's injected. And then the lipid capsule is taken up by cells. And then it releases the RNA. And then the RNA is there with a signal that then causes the cell to produce the spike protein, which then gets transported to the surface of the cell. And then the immune system sees that foreign material sitting on your cells and makes antibody. And once the RNA has discharged its duty to make the protein, it just gets chewed up. The body chews it up. That's what happens with all of our RNA too, whether we're making new cells for our intestine or new white blood cells or red blood cells. Once the program is read, the material that was programmed is chewed up. So that's what I meant by saying it doesn't live forever. I think I've heard people say that it gets incorporated into your own genetic material. It does not. It is right. There are little signals on it to tell the cell to make the spike protein. And then once it's done, it's done. My understanding is the mask does not protect the wearer, but protects others. So it's both. So that's the trick. The masks do filter stuff coming in. They also filter stuff going out. The most effective way to prevent is for the sick person to be wearing a mask and the non-sick person to be wearing a mask. And that is a double filter, so to speak, and keeps people safe. So how do we protect ourselves from unvaccinated people who refuse to mask? So that's the $1 million question. I'm sorry, I will make some kind of maybe personal reflection, and this has nothing to do with any of our hosts. This is my own opinion. So I started my infectious diseases career in 1981. June 5th, 1981 was the first report of AIDS coming from Los Angeles. From that point on, at least in my career, that was the first time that an infectious disease had become a political problem, where people weren't treated for their infection. They were treated for different concerns about lifestyle and other kinds of things that was separate from actually caring for the patients. This is another example of that with COVID. How this became a political football is not clear to me. And why a pandemic gets politicized is just not in anybody's best interest. And so the idea that masking takes away people's personal freedom is no different to me than yelling fire in a movie theater. It is infringing on other people's rights to be safe as well. And so I don't get it. Soapbox taken down. Yeah, I think you have to mask. If other people aren't going to mask, it'll protect you, right? It's better when it goes both ways. Someone asked, I have an upcoming jury trial. Can jurors be asked if they have been vaccinated in order to determine who wears a mask and who doesn't? That's a question for your management. I don't know the right answer, because I know that this is being battled in court in places where people have actually made mandates to get vaccinated. This isn't a mandate to get vaccinated, but it's something akin to that. Let me make one other comment, by the way. I've heard people say that these are experimental vaccines. They are not. They're approved vaccines. They're just approved because it's a pandemic. They're approved because they're fast-tracked because there's a pandemic going on. No one's collecting data on the however many million people in the United States have been vaccinated so far. Right? You're not getting a call every day from a study coordinator saying, how are you feeling today? Do you have any symptoms? These are not investigational vaccines any longer. They are approved vaccines, and all the information that the CDC gets on side effects and other things, that's the exact same system that they're using for every other vaccine that's available. So these are not experimental vaccines. We are at 3:38. I don't know whether I've done anything helpful or not, but I sure have been talking for a long time.
I think Daniel does that wrap it up, Daniel? Do you want to acknowledge?
Yes, I believe so. We've addressed all the questions in the chat. Thank you very much, Dr. Cohen. Keith, if you want to.
Yeah, I hope this was helpful. I am happy for anybody can send me an email, and I'm happy to answer. I know answering family questions is always funky, but I will give a medical response. And I think I think you guys have my email address somewhere. And so I don't mind if you pass it around to your folks.
All right, Keith, do you want to make the formal thank you? Thank you. This was very helpful, Doctor.
Yes, Dr. Cohen, thank you very much for speaking to all of our staffs. I just have one final question.
Sure.
It was whether that's a Zoom background behind you or is that your actual office?
No, this is my office. You know, I told you I didn't realize it was going to be a big open forum, or I would have stuck some kind of fake background behind it. But this is what I live in every day.
Well, I think it just tells us how busy you've been this last year. And I just wanted to thank you for taking time out of your day, especially on a holiday, to come and speak to our staff. Yeah. It's been very, very, very informative. Thank you.
No problem. Yes. Thank you. Anything else you need, just tell me.
All right. Thank you very much. Take care. We'll be.
Got it. Bye-bye, everybody.
Okay.
Thank you, Dr. Cohen.